Good day, it is Stephen Davids here, and in this video I want to show you how to test to see if someone didn't get a stroke or perhaps have suffered severe brain injuries or that his or her brain is affected. The reason behind this video is because I take care of someone, my wife, and she had a stroke, and sometimes we must go back to the hospital. Unnecessary, these tests I saw they perform. I just try to memorize these tests, and it is for my benefit and also for yours. I must just add a disclaimer, I'm not a medical doctor, and these tests do not exclude the doctor. I just copied what I saw they performed. So let us start immediately. The purpose of these tests are very simply to determine if the patient had some stroke that was not easy to detect, and these are the tests that I detected many doctors do, and also that the specialist neurologist he has done, and so I assume these are the standard tests. It's not necessary to have a checklist when you do these tests. Just do these tests in logical order. I observed they do the tests in logical order. You start with a speech test. These things I will explain later in greater detail. Start with a speech test. It is more just normal to greet someone, talk to someone. Thereafter do the lying down tests, because the patient is lying down. If you can lie down properly, test if the person can sit up, then you do a sit up test. You can sit up, maybe you can stand and do the standing still test, and then if you can stand still, maybe you can walk, and then you do the walking test. First set of tests are the speech test. It's just normal to greet someone, talk to him. What is your name? And these are simple questions, but it determines if the patient is confused, is his tongue slurring, how does he speak, how is his memory, what is your name, sir, how old are you, when were you born, what is your age, where do you stay. These simple questions, then is a person confused, can remember his long-term memory, etc. Then you can also test his short-term memory. What is today's date? What is the time today, sir? What is the day today? Is it Wednesday, Friday, something like that? If the person cannot recall for the short-term memory purposes test, perhaps the date or the name of the day, it is not a big smash. You just tell him then it is Saturday the 15th of whatever day, September example, and you also ask him in specific, I'm going to give you 3 things to recall, maybe a car, a ruler and a pencil. And then a few minutes later, or during the other test that you do, you just ask him again, sir, the patient, what is your name? Not what's your name, sorry, apologies. You want to test the short-term memory test. What day is it? What is the date of today? Can you recall the things that I specifically asked you? I asked you 3 things to recall. What is it? If the person cannot recall, you immediately know the person's short. As said before, start with the head and then move your test slowly down. Start with the facial expressions. Ask the person to make a few facial expressions and play around with his face for you and show him. Thereafter you can become more specific. Ask him to frown. Ask him to close his eyes tightly. Ask the patient to smile, and then ask the patient as part of that also to push out his tongue and move it from side to side. And then after you go to the eye tests, put your finger in front of the patient and then ask him to follow your eyes, your finger to the left first, and to the right, and see then if both eyes are in sync, and the whole person also can follow your eyes, your finger. Move it up and far up, and move it also far down. And in all these tests you try to determine facial expressions, etc. trials. Is one part drooping? Are they working in sync and working together? Thereafter, after the eye test, you go to the nose and then ask the person to touch his nose with his hand, and you put your finger in front of him and ask him, touch your own nose with your finger, and thereafter touch my finger with your same finger. I think that the test they do to see if the person has control over his body, can direction and speed, and are not so disorientated. You do it with a right arm and also with a left hand finger, up and down a few times. Thereafter you move to the mouth, and as I said, you let the person push out his or her tongue to the sides. After you finish these facial expression tests, you can use the sensory test on the face. The sensory test, you feel the parts of the person. Can you feel on the one side my hand, and is there a difference when I feel your face on the other side? Is there a difference? And tell me, can you feel my finger? Can you feel my finger? You then move up from that. After the feeling, you take a small sharp piece. In this case, toothpick is quite suffice, and ask the person, if I prick you slightly, is there a difference? Can you feel it, number one, on this side, on the left side? Can you feel it then also on the other side, on the left side? And can you feel it on the right side? And is there a difference in the impact? Is the one sharper than the other one? And from this you can determine if one side of the face is affected. You then move to the arms. Ask the person first to grab your hand. Let him grab your arm or your hand in his hand, and tell him, the patient, keep it tight, and then pull it out. And then you move to the other hand. First the left hand and then the right hand. And then you see how the strength, tell him, keep tight, hold my arm tightly, push it out. And if you see, then test the grip of his hand. Ask him also then to move out his fingers and to play with his fingers one by one. You can also just see if the fingers are there, the person has control over it. The one side, and you immediately, if you do a test relating to the hand, you do it the same test on the opposite arm. The reason is you want to compare, is there a noticeable difference between the left side and the right hand side? If there is a difference between the left side and the right hand side, it can be a new stroke, it can be also a past stroke, a stroke that's hidden. And the person, the neurosurgeon, the neurologist, they can tell it in detail. Your, as a lay caretaker, duty is to determine, is something wrong, I must take my beloved one to the doctor. And thereafter you do the arm bend test. Arm bend test, ask the person to bend his arm, ask the patient to bend his arm this way, inward. You grab the patient's arm around his wrist, and when you grab it around his wrist, you first pull it out. Tell him to restrain it. You pull it out and he must pull it back. You pull it out, he must pull it back. You test the strength on the one hand and then on the other hand. If there is a noticeable difference, of course you will take note of that. Then also, if not only pull, you ask him, keep your arms tight, bent, and I'm going to push your arm and you resist it. Push, you push, and he must resist it. You push and he must resist it. Alternative, you can do the push test this way. Namely, you take his hand against your hand, push it against your hand and say, I'm going to push your hand. I'm going to push your hand and you must resist it. You push and he resists. You push and he resists. And that way you can see then if there's anything out of place. Then you do the toe test. The toe test. Ask the person to push his toes to the front. Push it to the front while you push against it. And see then if how far he or she can resist it. You pull back, you push back, he push to the front. Okay? And then you put your fingers behind the toes. He push it back and you pull it back. He push back or she push back. And that way you can determine one leg and then the other leg. Is there a difference in the forces met? After the toes, you take the whole foot. Ask the person to push his foot to the front, pull his foot to the front. You restrain it. You do the opposite with the foot. He or she pushes it back and you restrain it. And then you can test the strength of the a person's legs and also in terms of the one foot in terms of the other foot. You ask the person then, patient, first lift your leg as far as high as you can. Lift it as high as you can and then pull it down. Lift it as high as you can, and you do this with the left and with the right leg. Okay? And then also you do a restraining test. Put your hand on the patient's leg. Ask him to pull it up, and then you can determine. Ask him also to lift it up and then push it down, and you restrain him when you do this. Okay? First have a test, then where you restrain him, and then where you lift it up. You then also ask the patient to bend his knee as far as possible in. See how and far he or she can bend it in and out. How far he and she can bend it in. Another test is of the person bend his leg, ask him then to push out while restrain it there. You must try to push out as hard as you can while you try to pull it back. And you see then if there's a difference between the two legs. You must bend it in, pull it out. You see if there's a difference between the leg. Of course, you repeat what you do on the one left hand, you do on the right hand side of the person's leg and person's body. Another test that they done was they asked you to lift your one foot up to the ankle and then push it slowly down to the foot and then repeat it. Push your ankle on your knee and push it slowly down to your foot. The purpose of that I do not know, but what I do know for a fact is that they look for consistency. What you must do on the one, it must be similar than your ability to do it on the other side. If, for example, the one side you can't reach, or you have some sort of... You also do a sensory test where the person must feel on the one side, the same must be done on the other side. Ask the patient, can you feel here on the one hand and can you feel on the other side? Is there a difference in your feeling that I do? Prick it perhaps, is there a difference? Can you feel a difference? And then the patient must tell you, yes, I can feel the side is more difficult than the other one. And as I said, it can then point the difference point to either new, unobserved brain injury or something that is past. The doctor will tell you as caretaker must see, is there a difference between now and yesterday or the few hours back? Ask the patient to sit upright, because the person could lie now, ask the person to sit upright. If he or she is able to pull up herself on the right, on his own right, it also is a good indication. You then do some of these leg tests again. You do these sitting leg tests again. Ask the person while he or she sits over the bed, the patient, push up your leg while you press it down. You must pull it up and pull it up, and then you lift it up, and then you must try to force it down. You must try to force it down. And you do what you do on the left hand side, you do on the right hand side, and you measure immediately how it feels. If you do one test, the down test, immediately do the down test on the other leg. You see if there is a difference. If the person can sit upright, you do now the standing test. Ask the person to stand upright. Just hold a hand there to support the person to see that everything is okay. To see that everything is okay. Can the person stand on his own? Or does he or her a little bit struggle? Lean to the side or what? Then you ask the person to walk a distance, a short distance, maybe to a wall. Walk. And when the person is walking, you observe how the person is walking, to the side, or he or she wants to fall to the side. And when this person maybe wants to a specific side, notice that, is it to the left, is it to the right consistently? Maybe the left side is not the right, or the right side, because that's also indication. Can the person indeed walk? How does a person walk? Does he or she pushes and slowly not walk upright, but pulls a leg? And what leg does the person pull? Those things must you notice. Lean a person to the side. He or she can't walk upright. Those are the small little things. The thing is that you as a caretaker must take note of. You're not a medical professional. You just need to determine, is this person different and worse than the person was the day before or a few hours back? Is my patient in my care worse? And then you take the person to the doctor. And the doctor then, they will perform the same test and other tests. Hopefully this video will help you to not waste your money, not go make a fool of yourself. But it's always better to take care. But as I say, you come now every time with the same things, and they do the same test and they send the person back. What's the use then? But it will help you. Please like and share this video, and we love constructive criticism. Thank you very much.